A new generation is hooked on an old drug. And make no mistake, nicotine can damage a developing brain. At Richview Collegiate in Toronto, grade 9 students are just learning about the dangers of vaping.
So learning goals for today's class, why e-cigarettes and vape pens are so popular with youth lately. Question 2. So e-cigarettes are devices that produce nicotine and are addictives in the form of a vapor, steam, aerosol.
New numbers reveal alarming increases among vaping in youth.
We just want to ask a couple questions. I think it would be more comfortable for you if you did this with your eyes closed, or heads on your desk if you'd like. So first question is, how many people know someone who vapes? Okay.
25 to 30% of Canadian high school students admit to vaping nicotine in the past month.
People just really thought it was really cool, and people were saying that, oh, it's just water, and that made you think that vaping was okay and that it was like nothing really.
Other answers are great. We knew those were correct as well, but yes, all of the above can be.
Educators like Janine Davies are trying to undo those messages, explaining the dangers of inhaling heated chemicals and how they were lured into it to begin with.
I really wanted them to see that what the big tobacco companies did was they found a new product and they found a new way to market something towards teens because cigarettes weren't working anymore.
I'm Jenny McCarthy, and I finally found a smarter alternative to cigarettes.
Enticing kids with sweet flavors, cool tricks, celebrities, and clever marketing on social media. The more they learn, the more some feel abandoned by governments and duped by big tobacco, now big vape in its new form.
Obviously they should care, but I don't think they really care because they just want the money.
When you endorse it and you make it popular, people really want to try that and be like, okay, so vaping is actually normal.
Normal and cool, just like cigarettes in the 1950s.
You'll feel better about smoking with a taste of Kent. Kind tasting to your throat, kind tasting to your taste buds.
But what happened to the lessons learned from smoking? How could yet another highly addictive, untested, and potentially deadly product end up on store shelves right next to candy?
We call them heated tobacco sticks.
David Hammond is a public health professor at the University of Waterloo.
The irony is we got here through an attempt to help adult smokers. We still have 5 million adult smokers. 1 out of every 2 or 3 are likely to die unless they quit.
In 2009, Health Canada was advising Canadians not to use e-cigarettes or vaping devices, stating there could be health risks. The devices were not authorized as smoking cessation aids and, according to Health Canada, hazardous to the health of children. But a vocal group of public health experts, including Hammond, supported the potential benefits of vaping.
I remember testifying to one of the federal committees and saying, smokers should have access to these. We need to be honest with smokers that they're not going to be as harmful as smoking.
It's been marketed as safe, and it's really misled them.
Experts, including Dr. Richard Stanwyck, argued right back, insisting Big Vape hadn't even proven the safety or effectiveness of their products.
Absolutely no evidence to suggest that these were going to be helpful in getting people off of cigarettes.
In 2015, Stanwyck wrote a paper warning vaping or e-cigarettes could end up renormalizing public smoking, reversing 5 decades of tobacco control and revitalizing nicotine dependency in children. But his side was losing the public health debate.
We're just seen as Luddites, that these are nervous Nellies, that they have found the solution. It's almost evangelical in this movement that the vape industry is the one that's going to solve the cigarette problem.
And we're here to talk about Bill S5, an act to amend the Tobacco Act.
Just last year, Health Canada made it official.
This bill is a key element of the government's broader tobacco control agenda,
putting basic restrictions on the manufacturing, sale, labeling, and promotion of vape products, nothing near the strict rules slapped on cigarettes. At the same time, high-dose nicotine products like Juul were entering the market and already appealing to children. Suddenly, both sides of the public health debate agreed. Health Canada's regulations were far too weak.
This is a nightmare for everybody. So we're failing both target markets. We're not protecting kids, and we're not actually doing a good job getting the products in the hands of people who could benefit, which is adult smokers, to quit. What does the future market hold? It can't look like it is today. Governments will need to take meaningful action so that we're still not talking about this problem and scratching our heads about what to do 2, 3, 4, 5 years from now.
Unlike health regulators in the United States who've declared a youth vaping epidemic, Health Canada has said relatively little about the rising number of children using nicotine, nor would it agree to an interview to talk about the crisis in kids, its failed attempt to help smokers quit, or what it plans to do next. Back at Richview, Janine Davies is teaching her students how to be media savvy in the new world of vaping.
On the left, we've got an old classic cigarette ad. On the right, we've got a new ad for a vaping product. So can you see the similarities between the two of them?
Oh, it's like it's good for you.
Yeah.
And like for us. Well, and like the way they portray it, it makes it seem like if you smoke, it'll be more desirable. Yeah. We said teenage girls, right?
Experts say the number of children vaping in this country hasn't plateaued yet.
Velo is the hassle-free nicotine pouch.
And for the first time in decades, Big Tobacco has a growing market, and a range of new nicotine delivery products are coming.
No limits.
As young Canadians quietly breathe new life into a dangerous old habit.
And we have Christine joining us now, along with CBC's medical sciences correspondent, Kelly Crow, and of course her story, Vape Fail, now available at CBC news.ca. So Christine, let's start with you though, because I mean, in your piece, we see more and more young people vaping, and yet these devices are illegal for kids. So big question, where are they getting them from?
I had the exact same question, and after that health class was over, I asked a group of grade 9 girls if they'd stay behind and try to answer some of these questions for me, because I honestly thought they were buying them online. And the girls said, well, we don't have credit cards. They said that some kids will buy prepaid credit cards in grocery stores, which are meant to be gift cards, but that's not how the bulk of them are getting them. They're actually picking them up at home. So mom or dad or an older sibling has tried vaping, maybe they tried a flavor and they don't like it, and then they leave them just lying around and they just get picked up right from the counters, right from the shelves. And also, the other way that they're getting them, and it's the same way that kids got cigarettes and they got booze, is there's always a trusted adult involved, and they go and buy them for them. But it is so easy for them to get their hands on them. The girl said to me, if you want, we'll take you out to the schoolyard right now. We can go buy some cartridges if you want.
Interesting. And speaking of adults though, I mean, Kelly, when you look at when e-cigarettes first hit the market, I mean, there was this suggestion out there that, hey, this could be a really useful tool in helping adults quit smoking. How much scientific evidence was there to back that up, that would happen?
Well, it wasn't just a suggestion. The entire federal policy is based on this, what is essentially an unproven hypothesis that this would work to help smokers quit. In fact, as the policy was being developed, there was not enough or really any evidence. And as it stands right now, the studies that are coming in are suggesting that these are 85 to 95% ineffective. So smokers are starting vaping, but many of them are just continuing to smoke.
Right.
So now we have dual users.
So Christine, the experts that you've spoken to, what do they say needs to happen next?
I would say the top 3 that I've heard in terms of changes would be to get rid of all the ads, limit the number of flavors, because that's what's drawing the kids in.
Young people, yeah.
Exactly. And also to lower the nicotine levels. Right now, in Canada, the limit is 60 milligrams per milliliter, and that is 3 times what the limit is in Europe.
This whole policy was designed to create as much access as possible, with a nod to trying to, possibly more than a nod, with an intention of restricting access to kids. Now that we've seen that this hasn't prevented youth uptake, people are calling for a restriction, in provinces and municipalities across the country are working on ways to narrow access to these devices.
Kelly, Christine, thanks very much.
You're welcome. Thank you.